Hi, my name is Vinod Rao, and I work at Spark, which is one of the partners of SDI or Shack Dwellers International, which is a network of slum dweller federations across the global south, largely in countries in Asia and Africa. As we started working on Arise, one of the key challenges that we felt that is right now challenging the urban health systems is very little investment in preventive and promotive health. Even where state institutions are making budgetary provisions and allocating a part of their GDP on health, it is much less in preventive health, but there is more investment in healthcare. Such as healthcare, which is largely curative based, such as hospitals or availability of medicines. Perhaps because that provides a much more tangible outcome from a political standpoint. Even where there are investments in preventive health, we see that those investments are low or misplaced, or they are not necessarily catering to the real issues at hand. So in India, we researchers started working with a group of women from slums and slum relocation colonies. They're already organized as federated women leaders of federated members of a community which is called Mahila Milan, or Women Together. They started working on tuberculosis, which is very prevalent in the areas that they live, because of both crowded living conditions as well as low access to nutrition because of poverty. And one of the things which they found was that the low access to nutrition in the family also meant that people with tuberculosis were largely easily infecting their family members because the nutritional systems were similar. Nutritional access was similar within the families. And in situations where TB was prevalent in one house, it was easily spreading to the other houses because of, again, poor access to nutrition and crowded places. So what they felt was that we do have a state investment that provides nutritional supplement to the person undergoing tuberculosis treatment, but that was not enough. The women felt that unless you support the entire family, the remaining family members will remain susceptible to catching the infection. They remain vulnerable to it. So this was a very nuanced finding that they did, and started providing nutrition supplements, and they're measuring the outcomes if it's really producing the change that they were envisioning, and it looks like it is. But this is, we wanted to say this because this is an example of how community members, who we call as co-researchers, working with researchers, can actually have a very nuanced viewpoint about a particular problem. And that's essentially what the ethos of SDI is. And if we allow much more of such participatory action research, not just research, but action research there, where there is a possibility of making an action investment into communities which are participating in the research, then it allows a more nuanced solutions to emerge. It looks at problems in a much more nuanced way, and the solutions that emerge are much more impactful and real. So it is our ask to the larger global research community to invest more into participatory action research for much more impactful and real outcomes for the people. Thank you.